Hello, my name is Dr. Dewan S. Raja. Today I will discuss about mucous membrane pemphigoid, also called MMP, also called psychiatrical pemphigoid. So, mucous membrane pemphigoid or psychiatrical pemphigoid is a chronic autoimmune subepithelial blistering disease that primarily affect mucous membrane and sometimes the skin. So it is predominantly a disease of the mucous membrane, but skin is also affected. Around 20 to 30% cases, it may be scalp, skin, maybe skin on the forearm. It is characterized by scarring, so it is called cicatricial lesion, especially in the eyes, oral cavity, pharynx, and genital mucosa. Epidemiology is most common in older adults greater than 60 years. Sex, slight female predominance. It is a rare disease, not common. Okay, we are seeing mucous membrane in the oral lesion here. This is the perineal or perianal region here. This is the problem of the conjunctiva, both the bulbar conjunctiva and the palpebral conjunctiva is affected. This is the skin or mucous membrane over the glans penis. Here's the skin of the penis. So it may happen in the scalp, on the head, also in the arm and other parts of the body. But it is mostly a mucous membrane disease. Pathophysiology. Autoantibodies target components of the basement membrane zone. BP180 type 17 collagen, BP230, laminin 332, particularly in more severe cases. Okay, we'll get antibodies against them, autoantibodies. This leads to detachment of epithelium from the underlying connective tissue. There will be subepithelial blistering. Okay, so we got that. Here, clinical feature, mucosal involvement, most common, oral cavity, painful erosion, gingival involvement, desquamative gingivitis, ocular conjunctivitis, symbolpharon, blindness, there may be corneal ulcer, adhesion between the eyelids, if untreated, nasal, laryngeal, and esophageal mucosa may be affected. You may have dysphagia, difficulty in swallowing deglutition. Hoarseness of voice is also possible. Genital and anal mucosa, painful ulcer, there may be scarring. Actually, there is scarring, not maybe. This is a disease with ulcer and scarring. Okay, skin involvement, around 20 to 30% cases, tense blister or erosions, especially on the head. Head means here on the skull, neck, and upper trunk. Okay, how to diagnose? Diagnosis. Clinical suspicion based on site, chronicity, and scarring. Histopathology, subepidermal blister with eosinophil. Direct immunofluorescence, linear deposition of IgG C3 at the basement membrane zone. direct immunofluorescence, circulating IgG antibodies, and not always positive, ELISA or immunobold for specific antibodies, BP180, laminin 332. Complication, there will be blindness, ocular involvement, there will be corneal ulcer, two eyelids may be adhered, area compromise, laryngeal scarring, esophageal stricture, so that may lead to dysphagia, airway compromise, laryngeal scarring may lead to hoarseness of voice or respiratory disturbances, chronic pain and instability. Treatment mild, that is isolated oral involvement, topical corticosteroid, Dapsone if no glucose 6-phosphate dehydrogenase deficiency, tetracycline plus nicotinamide, moderate to severe ocular genital airway involvement, systemic corticosteroid, that is prednisone, immunosuppressant, azathioprine, mycophenolate mofetil, biologic rituximab, anti-CD20, ophthalmologic and ENT evaluation is critical. These are critical. Differential diagnosis, we may have confusion sometimes. In the list of differential diagnosis, important items are pemphigus vulgaris, is intraepithelial more superficial blister, bullous pemphigoid. Mucous membrane usually not involved in bullous pemphigoid, less chance. Linear IgA disease will get the IgA in lieu of IgG. Will get IgA in this disease. Lichen planus, oral erosive form, lichen planus. So these are the differential diagnosis of mucous membrane pemphigoid MMP. And that's all about the mucous membrane pemphigoid. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.